So what exactly determines the hair volume, hair density, as well as the hair length? I have told in my previous video that anagen is the growing phase of hair. The hair length will depend upon this growth stage known as anagen. It normally is around 3 to 8 years, but it varies from different side to side. For example, scalp hair has the longest duration of anagen. That is why scalp hair can grow as long as several centimeters. Similarly, eyebrow, eyelashes have different anagen and a shorter anagen. That is why they cannot grow as long as scalp hair, even if you don't trim them, even if you don't cut them at all. But why is it important? People who have something known as alopecia universalis, or people who have sparse eyebrows, wants to get eyebrow transplant done, and then we tend to take some scalp hair and put it on the eyebrows to give you that dense growth of eyebrows. But if this is the scalp hair that has been transplanted on the eyebrow, it can grow as per the growth of scalp hair. So it is going to grow longer and longer if it is not cut regularly. So whenever you get eyebrow transplants done, you have to keep this in mind, that you have to regularly trim your eyebrows in order to get the best aesthetic result. Density is the number of hair per square centimeters area. So it is more of a genetically determined phenomena, and most of the time the density throughout the life will remain constant until and unless you suffer from androgenetic alopecia or other causes of baldness. The moment you start perceiving baldness, 50% of the hair is already lost. So you are already too late in a stage in order to preserve the hair density. As of now, there is not enough data as to which treatment is going to increase hair density. Not even hair transplant. Hair transplant never increases hair density. It just transports the back hair onto the front, giving you an illusion of denser hair. But total number of hair remains constant. The total hair density remains constant even with hair transplant. The newer data and a new novel therapy is stem cell therapy, and it can lead to increased hair density. But it is in a very early stage and no conclusive results can be said as of now. But if you are looking for something with a more density of hair, you can opt for stem cell therapy. The next component is hair volume, and this is something that we as dermatologists can definitely take care of. It can be taken care with tablets, with PRP, stem cell therapy, mesotherapy, everything in between. Most of the people come with diffuse thinning of hair. So the thickness of individual hair has decreased. If we will increase the thickness of individual hair, the hair volume is going to increase. So imagine a forest which has very thin trees with very sparse leaves. That forest will not look as dense as compared to a forest which has thick, huge trunk as well as large florid leaves forming a canopy. Same goes with hair as well. If the individual thickness increases, the hair volume also increases, which on a molecular level is determined by the dermal papilla of hair.